I'm going to share my screen. Great. All right. Hi, everyone. My name is Katrina Wong. I am a pelvic floor physical therapist, and I specialize in women and men's pelvic health. Today, I'll be doing a master class on birth prep for prenatal pregnant individuals. I'm really excited to talk about some great information to help you prepare for your birth. If you have any questions, please feel to type them in the comments below, or you can email me. My email will be available at the end of the slides. Okay, a little bit about me is that I graduated with my doctorate of physical therapy from Mount St. Mary's University. And again, like I mentioned before, I'm very passionate about pelvic health physical therapy. I really enjoy seeing pregnant and postpartum moms just get back to their prior exercise level, or whether they're trying to prepare for their childbirth. So again, it's one of my areas of, I guess, highest passions, and I'm really looking forward to sharing some great information. So we're first going to start talking about what is your pelvic floor. So the purpose of this masterclass is to teach you how to connect to your pelvic floor and how what you can do in terms of exercises or techniques to help decrease your risk of tearing, to help you push your baby out, just to help the overall birth experience. So we're going to talk about what your pelvic floor is first, and then we'll kind of go into just different things that you can do, including perineal massage, open glottis pushing techniques, as well as stretches to just get your pelvic floor and your body ready for childbirth. So first, what is your pelvic floor? So your pelvic floor is a set of muscles that forms the base of your pelvis. So I have a picture here, and this is a bottom view of your pelvis. So it's going to show my pelvic model. So this is my pelvic model here. And then if I take the bottom view of the pelvis, we can see all these muscles in red. So we have our top here, which is our pubic bone. We have our tailbone and anus, and then we have our two sitz bones. And these bones are the bones that we sit on, like when we're sitting on a chair. So if I do this again, so again, this is the front view of the pelvis. These would be our sitz bones. This is the bottom view, sitz bones here, the pubic bone, as well as the tailbone. So your pelvic floor muscles span from your pubic bone to your tailbone and then across into your sitz bones. So we're going to orient ourselves. Again, north would be pubic bone, south would be tailbone, and then west and east would be your sitz bones, or called your ischial tuberosities. So there are a total of 19 muscles that make up your pelvic floor. And each hole, whether that be your urethra, your vagina, or your anus, are surrounded by muscles. So these muscles are circular in nature, kind of like how, for example, your urethra is canal shaped. And the goal when getting ready for childbirth is you really want a nice, soft, and relaxed pelvic floor, so that's very easy for baby to come out. So again, I have my model here, and you want all of these muscles to be very soft so that when the baby exits out the vaginal canal, that the muscles can easily stretch and soften to accommodate the baby's head and the body. So here's a very good close-up picture. So again, we have our two sitz bones. We have our pubic bone, and then we have our tailbone. So this will be the anus, the vagina, and then the urethra. So you can see that all these muscles in red, and the light blue colored is just fascia or connective tissue. All of these tissues and muscles need to be able to relax and lengthen to allow the baby to exit. I also really like this picture. So this is a side view of the pelvis. So in the front, we have our pubic bone. In the back, we have our tailbone. And then we have these three circular canals, the urethra, vaginal canal, and the rectum. And each of these canals is surrounded by circular muscles that help perform many different functions. So not only help relax to help with childbirth, but they also contract to help, for example, maintain continence of pee or poop. And you can see the pelvis is made of so many different muscles. So if I have a bottom view of my pelvis, you can see all of these muscles in red here are your pelvic floor. I'm just going to take out the rectum. So this bowl is like kind of like a hammock. So your baby is really sitting in this bowl, and the muscles here are supporting all your organs as well as your the growing baby. So how much does your pelvic floor stretch? So the pelvic floor muscles have a wonderful capacity to stretch, and it can stretch anywhere between 25 to 250% during childbirth, which is actually a lot. And this is completely normal and necessary to allow the baby to exit from the birth canal. So I really like this photo as well. It just shows all your muscles in red here. And it shows just that bottom of that bowl. So your pelvic floor muscles need to be not only, I wouldn't say strong, but pliable, flexible, mobile, lengthened to be able to accommodate the baby. And this is just one more photo just showing how these muscles have a wonderful capacity to stretch. So I really like this photo because your pelvic floor muscles do have the capacity to stretch. I'm just going to teach you a few things that you can do to help facilitate that stretch, as well as some pushing or breathing techniques to help you soften that pelvic floor. So how to prepare for childbirth. So whether this is your first baby and you're preparing for a vaginal delivery or C-section or a vaginal birth after a cesarean, you can really do a lot to prepare your body and your pelvic floor muscles. So we're going to learn about diaphragmatic breathing, perineal massage, some relaxation stretches and exercises for the pelvic floor. We'll also learn about some pushing techniques and just ways to breathe to soften that pelvic floor, as well as labor positions and just visual imagery or cues you can think about when your doctor tells you to start pushing your baby out. So we'll first talk about diaphragmatic breathing. So the video is playing right now, but I'm just going to talk a little bit about your diaphragm. So your diaphragm and your pelvic floor work together. So what that means is that you can use your breath or your breathing muscle to help relax your pelvic floor. So we can see here, we have our diaphragm at the top and then our pelvic floor at the bottom. You can see as you inhale, the diaphragm is going to drop and pelvic floor drops and lengthens. When you exhale, diaphragm and pelvic floor come up. So it's like this piston type of motion. So when you inhale, diaphragm comes down, pelvic floor lengthens. When you exhale, diaphragm and pelvic floor come up. So you can see how just when you're breathing, that allows the pelvic floor muscles to lengthen and come back to its starting position. So every muscle in our body should be able to move through its full range of motion. And this is what the pelvic floor needs to do. It needs to be able to move through its full range of motion to fully lengthen to allow the baby to easily come out. So diaphragmatic breathing is a really great exercise that you can start doing very early on during your pregnancy, just to stay connected with your pelvic floor. So if we're going to do that, what you can do is you can just, while you're watching this video, you can just sit here. You're just going to put your hands, just going to put your hands around your ribs and your abdomen. And what you're going to do is you're going to inhale and expand, and then exhale, relax. So you're going to inhale, expand your abdomen 360 degrees, and also south down towards the pelvic floor. So you're really thinking about inhale, expand the balloon, and then exhale, just let it relax. So this is a great exercise you can do. I do have another video posted on my YouTube channel about how to do this breathing for more information. Perineal massage is another one of my go-to tools to teach my prenatal individuals. And the goal of perineal massage is to teach you to be aware of those muscles and to prepare those muscles for a big stretch. So the fact is that most women do tear during their delivery. And the thing with perineal massage is that it's just going to reduce the risk of the severe tears. So there's different grades of tears, which we'll go over the next slide. But what I have to say is that just because you do perineal massage doesn't mean that you won't tear at all. It's just going to help decrease how much tearing that you have, and most importantly, get you connected to your pelvic floor so you know how to relax those muscles when the baby's kind of knocking at your perineum or your opening and saying, I'm ready to come out. So with perineal massage, I will go over it with my model. So we have our model here, and this part is your perineum. So again, this is the front view, and this is the bottom view. And the perineum is the location between your vagina and your anus. And this perineum is the part that needs to be able to lengthen and also relax and stretch to allow the baby's head to descend and get out of the vaginal canal. So when you're doing the massage, you want to aim to work from 3 o'clock to 9 o'clock. So if this is 12, 6, 3, and 9, you want to aim to massage the bottom half. And what you want to do is you want to start doing this around 32 weeks of your pregnancy. And you can use a lubricant or just a lubricant that you feel comfortable with. And you're slowly going to insert your finger into your vaginal canal and start just kind of pressing down, pressing in, and then pressing out. So it's almost like you're giving those muscles kind of like a stretch. Now, you don't want the stretch to be super uncomfortable, but it will definitely feel like a stretch. And the goal is to just learn how to respond in a relaxed manner when you're doing that stretch. So you don't want to do this stretching if it's really painful and you're just tightening up your pelvic floor. You really want to be able to learn how to relax and breathe into your pelvic floor as you're doing the stretching. So again, if I insert I'm just going to take this top piece out. So if I insert my finger, you really want to insert and then stretch and hold and breathe. And then hold it just for about 15 to 30 seconds. You can release and then find a new spot. So you can insert and press down and breathe. So basically, you're just kind of stretching that vaginal opening and preparing those muscles to stretch and soften. So I recommend doing this about 3 to 4 times a week for 10 to 15 minutes. And you can do more if you would like. But generally, I have my patients lay on their back and do the massage. Or you can have your partner do the massage as well. So this is the part I want to talk about as well. So there's different degrees of tearing. So again, perineal massage doesn't mean that you won't tear at all, but it may help you decrease your risk of getting severe tears, which include the 3rd and 4th degree tears, which tear all the way into your anal structures. So a lot of my patients who do perineal massage, they only tear either a little bit or they don't even tear at all. So they might tear like something called a 1st or 2nd degree tear, which is a very superficial tear that just tears at the pelvic floor musculature without going into the anus. So perineal massage is a wonderful tool, and I highly recommend it during starting around 32 to 34 weeks of your pregnancy. So there are also some really great stretches that you can do to relax your pelvic floor. So I really like sitting on a tennis ball. So the purpose is that you're using a tennis ball almost like a massage tool to help soften your pelvic floor muscles. So what you want to do is if you're just sitting, so I have my pelvic model here. If you're sitting, you want to put the tennis ball between your sitz bone and your anus. So you want to put the tennis ball in this location. So I'm just going to get a golf ball actually. So what you're going to do, again, if this is the bottom view, you're going to place the tennis ball between your sitz bone and your anus and put it right here. So you can see where that golf ball or that tennis ball is. I recommend using a tennis ball, is that it's going to actually massage all of these wonderful muscles that need to be able to stretch very well. So what you can do is you can sit down, put a tennis ball right here, and And then you're just going to sit on it for 1 to 2 minutes and do some nice breathing. So when you're breathing, I really want you to think about breathing down into your pelvic floor muscles, almost like as you take a deep inhale in, pelvic floor is going to relax and drop. So again, a really great tool, very simple. You can use a tennis ball or any type of massage ball. Lacrosse ball might be a little bit hard. Same with the golf ball. So that's why I like tennis balls, because they're a little bit more squishy and have a little bit more give to it. All right, next we're going to go over some stretches that you can do during your pregnancy. So the purpose of these stretches is that it's going to help keep your pelvis nice and open and relaxed, and keep those muscles nice and soft and supple to be able to lengthen and relax as the baby is finding its way out of your pelvis. So I love the down dog because the down dog really helps mobilize your buttock or your butt muscles, as well as your hamstrings, and it helps prepare your ischial tuberosities to widen to allow the baby to exit. So again, this is my pelvic model here, and your hamstrings actually attached to each of your sits bones here. So if you look at the bottom view, these sits bones need to be able to expand outwards to allow the pelvis to open. So I'll show you what I mean in a few slides too. But again, this is a wonderful exercise that I recommend all my pregnant clients to do. The hip flexor stretch is also a really great stretch. So the hip flexors are present in the front of your pelvis, and these muscles need to be nice and soft to allow, again, the baby to descend into your pelvis. So I really like the photo on the left. It's showing the baby at different stages. So if you're having difficulty, let's say if the baby's not really engaging into the pelvis, the hip flexor stretch is a great option to help open up those front muscles. So you can see in the diagram here that these muscles are present in that pelvic bowl or that pelvic cavity, and those muscles need to be able to be supple and hydrated and soft to allow the baby to engage into the pelvis. And then the deep squat is another great option too. And again, it helps open up the pelvic outlet to help the baby exit. So I love the deep squat. If you're having difficulty going into this position, you can totally just have like a pillow or a yoga block underneath your buttocks so that the position isn't too difficult to hold. So I recommend doing these stretches throughout your pregnancy and hold for at least 30 seconds to a minute. You can definitely do a couple reps per stretch daily. All right, so we're going to go over some pushing techniques. So the important part with pushing is that you want to push when you feel like you need to. So you don't want to, waste your energy pushing the whole time. But when you feel like your baby is like, getting ready to, go further into your birth canal, or when your doctor tells you to push, there is a strategy called open glottis pushing that can be really helpful. So we went over diaphragmatic breathing. This is going to be a little bit different, but similar. So to do open glottis pushing, the whole idea when you push is that you want to keep your throat open. So you don't want to bear down and be like really like hold your breath and really push down. You really want to think about exhaling, blowing out, keeping your throat open as you're trying to push your baby out. So what I recommend is you're going to think about inhaling, expanding your abdomen, and you're going to exhale through your mouth as you imagine sending your breath downwards towards your pelvic floor and bulging and lengthening that pelvic floor. So it'll be an inhale, expand your belly. Exhale, imagine sending your breath down. So if you feel that when you exhale and bear down, you should almost feel like, again, the breath is kind of flowering your pelvic floor open. So your pelvic floor, as you exhale, you should almost feel like you're just lengthening that pelvic floor to allow baby's head to slowly exit from the birth canal. So whenever you feel like your baby is knocking on your perineum or is ready to come out, I really recommend trying this breathing strategy to help facilitate movement of the baby in or throughout your pelvis. So we'll also talk about some labor positions. So let's try and understand what position is most beneficial to help relax your pelvic floor and deliver your baby. So these labor positions are important to consider as your as your baby is exiting out of your pelvis. So this is the part when you're pushing the baby out. So if you just sit on a chair for me, I want you to cup your sits bones with your hands. Now those sits bones, if you look on the diagram, are again those blue structures at the bottom of your pelvis. So what I want you to do is just with your hands cupped around your sits bones, I want you to lean forward. So if you just lean forward, you'll notice that your sits bones actually draw further away from each other. So again, lean forward and really feel your sits bones draw apart. So again, as you lean forward, that's going to open up your pelvic floor. As you lean back, you'll notice that your sits bones come a little bit closer together. Now let's have you rotate your femurs. So your femurs are your thighs. So what I want you to do is I want you to rotate your hips internally. So internally means that your knees are kind of knocked knee and your ankles are further apart. So if you notice that as you bring your knees together and your ankles apart, it actually opens up your sits bones away from each other. So try that again. You still cup the base of your pelvis. As you bring your knees together and your feet apart, your sits bones draw away. And then as you rotate your feet in and your knees out, that actually draws your sits bones together. So knowing that we can actually change the positioning of your sits bones is really important because it tells us a lot about what labor positions may be most optimal. So as we can see, leaning forwards and having your hips internally rotated actually opens up your sits bones. It opens up these bones here to draw apart, making the pelvic floor more relaxed. So I have this really great video. So you can see when I'm internally rotated, it draws apart, externally rotated, it comes together. So you can see when in this photo, as my knees are apart and my feet are together, that opening at the bottom of the pelvis is really small. So that means baby's gonna have a pretty challenging time to exit. But if I have my knees more kind of together and my feet out, that really opens up your bottom of your pelvis. It's gonna make it a lot easier for your baby to exit out. Let's play it a few times. So really great video. It's gonna play it one more time. It just shows that you can really do a lot to change the opening of your pelvic outlet to make it a lot easier for your baby to exit. I also really like this video. So if baby's trying to come down into your pelvis, if your hips are externally rotated, that opening is gonna be a lot smaller. But if you internally rotate, that's gonna really allow baby to exit. And if we look at the bottom view, again, if our hips are externally rotated, it's very difficult. But if our hips are internally rotated, it's gonna make more room for the baby. So I'll play that one more time. Have my cute little owl. Baby's trying to exit. Okay, look at the bottom view. So really, you can do a lot to really open up your pelvic outlet. So the pelvic outlet is the bottom of the pelvis. Okay, we're gonna go over some labor positions. So knowing what we know, knowing that when our hips are internally rotated, so when our hips are internally rotated, that means our knees are together, our feet are apart, that's gonna help soften and lengthen the pelvic floor. So I'm gonna go over some birth positions. So the first one is on your back, and you want a towel roll to support your, there you go. So you want a towel roll in a U shape to support the bottom of your pelvis. Now, the reason why you want a towel roll is because, let's say, okay, this is your pelvis. when you're laying on your back, your tailbone here needs to move out of the way to allow the baby to come out. So if you're just laying on your back, there's going to be no way possible that tailbone is going to have room to come out of the way because you're laying on it. But if you have a towel roll, you're elevating your tailbone off from a surface, and that's going to allow room for this tailbone to get out of the way. So again, this is one position you can do. You lay on your back. You're going to have your hips internally rotated, so knees together, ankles apart, like so. The second one is quadruped on a birth ball. Again, hips internally rotated. And then the last one is side lying with your knees together and your feet apart. So those are just 3 labor positions you can try. It's not the only 3, but really great options so that you're not just laying, or that you're not just delivering on your back. So there's definitely way more options than the lithotomy position, which is what most people are in, where they just lay on their back and have their feet in stirrups. So you really want to take advantage of what your body can do and really put your body in positions that are going to relax your pelvic floor, that are going to open up your pelvic outlet. So it means less, so it means more energy efficient for you, as well as making it more energy efficient for the baby to exit from the vaginal canal. So some great imagery to think about is, imagine your pelvic floor blowing up like a balloon. So once you feel like you need to push or you need to soften your pelvic floor, think about your pelvic floor relaxing like a balloon. Think about your pelvic floor melting like butter, opening up like a flower, or think about it being nice and soft like pillows and clouds. So these are just different visuals you can think about to help you relax your pelvic floor. And I'll just talk about some just extra tips. So just a reminder, you have your breath. So remember that your diaphragm and your pelvic floor work together. So if you feel like your pelvic floor is really tight or you're tightening down there and you can't really relax, don't forget to breathe. Breathing directly helps relax your pelvic floor. So just as a little tip, let's say if you're stressed and you're clenching your jaw, do you feel your pelvic floor kind of tightening? So again, try to clench your jaw for me. And just take note of what happens to your pelvic floor. Your pelvic floor muscles, you start to squeeze your anus and your pee hole. But if you breathe, those muscles start to relax. So when your doctor's telling you to push, don't try and clench and squeeze really hard, because that's actually not going to help your pelvic floor relax. It's going to do the opposite. It's going to cause your pelvic floor to shut close and tighten. So really take advantage of your breath and your diaphragm. Those are some just very valuable tools that you have. And again, when your baby starts to knock at your perineum, so when it's crowning, picture a soft and open perineum. Perineum being this portion of your pelvic floor. So picture a very soft vaginal opening, because the perineum is at the highest risk of tearing during the crowning phase. So you really want to just soften those muscles. Try not to tighten those muscles as you're delivering. All right, so I hope that was really helpful. Again, this was just a short masterclass on what you can do to prepare for childbirth. So we talked a little bit about your pelvic floor anatomy, what things you can do to help prepare your pelvic floor for childbirth. If you want to learn more, you can follow me on Instagram at The Faithful Pelvis. And if you have any questions or would like some one-on-one care, or just have any questions at all, feel free to email me at katrinawong14@gmail.com, and I'd be happy to answer any questions. Thank you.